Imagine waking up early in the morning before the day fully begins. The house is quiet, the air feels still, and the first thing on your mind isn't breakfast or coffee. Instead, you reach for the small device sitting on your kitchen counter, your glucose monitor. For many people managing blood sugar, this moment has become part of a daily routine. A small finger prick, a drop of blood placed carefully on the strip, and then a few seconds of waiting while the device calculates the result. Then the number appears, and it's higher than you expected. Maybe you were careful with dinner the night before. Maybe you avoided sugary foods and tried to make healthy choices throughout the day. Yet somehow, the number staring back at you doesn't reflect that effort. It can feel confusing, sometimes even discouraging. Many people immediately begin asking themselves questions. Why is my blood sugar elevated even before I've eaten anything? What is happening inside my body overnight? And most importantly, is there anything I can do to help stabilize these numbers naturally while still following my doctor's guidance? The truth is that blood sugar regulation involves far more than simply avoiding sugar. Your body's glucose levels are influenced by several systems working together. Hormones released during sleep, liver activity that produces glucose during the night, how sensitive your cells are to insulin, and even the health of your blood vessels can all influence the number you see on that screen in the morning. But here's something that many people overlook. Sometimes the body doesn't just need fewer carbohydrates or stricter diets. Sometimes it needs support for the systems responsible for using glucose properly. Systems like insulin signaling, cellular metabolism, and the health of the arteries that carry nutrients and oxygen throughout the body. And interestingly enough, some of that support may come from something surprisingly simple, not from complicated supplements or expensive health products, but from certain oils that many people already have sitting quietly in their kitchens. These oils contain natural compounds that researchers have been studying for their ability to influence inflammation, support insulin sensitivity, and help protect the delicate lining of the arteries. When those systems function better, the body often manages glucose more efficiently. In today's discussion, we're going to explore how specific oils may support metabolic health and help create a more stable internal environment for blood sugar regulation. Before we go any further, let me introduce myself and explain exactly what we're going to explore together today. My name is Dr. Thompson, and much of my work focuses on understanding how everyday nutrition influences metabolic health. Conditions like insulin resistance, type 2 diabetes, and cardiovascular disease are deeply connected to the way our bodies process nutrients, regulate hormones, and maintain the health of our blood vessels. Over the years, one thing has become increasingly clear in both research and clinical observation. Small nutritional factors, when used consistently, can sometimes influence metabolic systems in surprisingly meaningful ways. Not because they act like medications, and certainly not because they provide instant results, but because they support the natural biological processes already taking place inside the body. That brings us to the focus of today's discussion. In this video, we're going to explore 3 oils that research suggests may support blood sugar balance and arterial health. These are not exotic substances that require special ordering from distant parts of the world. They are oils that many people already use in cooking or have seen in grocery stores countless times. What makes these oils particularly interesting is the collection of natural compounds they contain. Compounds such as healthy fatty acids, antioxidants, and plant-derived molecules that interact with metabolic pathways involved in glucose regulation and cardiovascular function. Some of these compounds appear to influence how sensitive cells are to insulin signals, which can affect how efficiently glucose is removed from the bloodstream. Others help reduce inflammation and oxidative stress inside blood vessels, which supports healthier circulation and protects the delicate lining of the arteries. When these systems function more efficiently, the body is often better able to maintain stable glucose levels and reduce some of the metabolic strain that develops over time. Now, it's important to understand that oils themselves are not treatments or cures for metabolic diseases. They are simply nutritional components that may provide support for the systems responsible for maintaining metabolic balance. By understanding how these oils work at the biochemical level, you can make more informed choices about how they might fit into your overall approach to supporting blood sugar control and cardiovascular health. Before we begin looking at the first oil, It's important to pause for a moment and place everything we're about to discuss in the proper context. Whenever people hear that certain foods or natural ingredients may support blood sugar control, it's easy for misunderstandings to happen. Some individuals begin to think of these foods as replacements for medications or medical care. That is never the intention of discussions like this, and it's something I always want to clarify clearly from the start. Oils, spices, herbs, and nutritional strategies should never replace the guidance of your physician or the treatment plan that has been designed for you. Conditions such as diabetes, insulin resistance, and cardiovascular disease are complex metabolic disorders that require careful medical supervision. What we're discussing today belongs to a different category entirely. These oils represent supportive nutritional tools that may complement the systems already working inside your body. They can be thought of as part of a broader lifestyle approach that includes balanced meals, regular movement, proper sleep, stress management, and professional medical care. Modern research has begun to show that certain natural foods contain compounds capable of influencing metabolic processes at the cellular level. These compounds can affect how the body absorbs nutrients, how cells respond to insulin signals, and how inflammation develops inside blood vessels. But even when studies show promising effects, the results rarely come from a single food acting alone. Instead, improvements in metabolic health usually happen gradually when multiple supportive factors work together. Consistent nutrition, healthy fats, physical activity, hydration, and medical guidance all combine to influence how the body regulates glucose and maintains cardiovascular health. When people understand this bigger picture, they are less likely to search for quick fixes and more likely to focus on sustainable habits that support their body over time. That's the perspective we will keep throughout this discussion. The oils we are about to explore are not miracle solutions. They are simply natural sources of nutrients and plant compounds that may support important metabolic systems when used consistently and sensibly as part of a balanced lifestyle. With that understanding in place, we can now take a closer look at how certain oils interact with the biological processes that regulate blood sugar and protect the arteries. To understand why certain oils may support blood sugar balance and arterial health, it helps to first understand what is happening inside the body when glucose regulation begins to struggle. Every time you eat foods that contain carbohydrates, your digestive system breaks those carbohydrates down into glucose. That glucose then enters your bloodstream and becomes the primary fuel your body uses to power cells, organs, and muscles. In response to rising glucose levels, your pancreas releases a hormone called insulin. Insulin acts like a messenger. It signals cells throughout your body, particularly in muscle and liver tissue, to absorb glucose from the bloodstream so it can be used for energy or stored for later use. When this system works efficiently, blood sugar rises slightly after a meal and then gradually returns to a healthy range as cells absorb the glucose they need. However, several factors can interfere with this process over time. One of the most common is insulin resistance. In this condition, cells become less responsive to insulin signals. When that happens, glucose remains circulating in the bloodstream longer than it should, forcing the pancreas to release more insulin in an attempt to compensate. At the same time, elevated glucose levels begin to affect the health of blood vessels. High blood sugar increases oxidative stress and inflammation inside the delicate lining of arteries, a layer of cells known as the endothelium. When the endothelium becomes damaged, arteries can gradually lose their flexibility and become more vulnerable to plaque buildup. This is where certain dietary fats begin to play an important role. Not all fats behave the same way inside the body. Some fats contribute to inflammation and metabolic stress, while others support cellular function and help regulate metabolic processes. Oils that contain healthy fatty acids, particularly monounsaturated and omega-3 fats, can influence several systems connected to blood sugar control and vascular health. These healthy fats become part of cell membranes, affecting how cells respond to insulin signals. When cell membranes remain flexible and healthy, insulin receptors tend to function more efficiently, allowing glucose to enter cells more easily. In addition, many natural oils contain antioxidant compounds that help reduce oxidative stress inside blood vessels. By protecting the endothelial lining of arteries, these compounds support better circulation and reduce some of the strain that metabolic disorders place on the cardiovascular system. When these mechanisms work together, improved insulin sensitivity, reduced inflammation, and healthier blood vessels, the body is often better able to maintain stable glucose levels and protect long-term cardiovascular health. Before we move on to the first oil, I'd like to pause for a moment and ask you something simple. If you feel comfortable sharing, take a moment to write your first name and your age in the comments below. It might seem like a small detail, but it actually helps create something meaningful around conversations like this. One of the most encouraging things about discussing metabolic health online is realizing how many people are walking the same path. Managing blood sugar, improving cardiovascular health, and understanding how nutrition affects the body are challenges faced by millions of people around the world. When viewers share a little about themselves, even something as simple as their name and age, it helps build a sense of community. It reminds everyone watching that they are not navigating these health questions alone. Over the years, I've seen people from their 40s, 50s, 60s, and well into their 70s and 80s take steps to better understand how their bodies work. One of the remarkable things about the human body is that many of its systems remain responsive to positive changes, even later in life. Metabolism is not something that becomes permanently fixed. While it does change as we age, the systems that regulate blood sugar, circulation, and cellular energy can still improve when they receive consistent support from healthy habits. That support can come from many directions: balanced meals that contain fiber and healthy fats, regular physical activity that helps muscles absorb glucose more efficiently, adequate sleep that allows hormones to regulate properly, and of course, guidance from medical professionals who understand your individual health needs. Nutrition also plays an important role in this process. When people begin to understand how certain foods interact with metabolic pathways, they often start making small adjustments that support their body more effectively. These changes rarely happen overnight, but over time they can influence how the body manages glucose, how efficiently cells respond to insulin, and how well blood vessels maintain their flexibility. So, if you're comfortable, share your name and your age below. It helps me understand who this information is reaching, and it helps create a community of people who are all working toward the same goal, supporting their health with knowledge, practical habits, and steady progress. Now, with that in mind, let's begin with the first oil. And it's one that many people already have in their kitchens, often without realizing how important it can be for metabolic and cardiovascular health. Extra virgin olive oil. For thousands of years, olive oil has been a central part of traditional diets, especially in Mediterranean regions, where it has long been used as a primary source of dietary fat. In these cultures, olive oil is not just a cooking ingredient. It is a foundational part of everyday meals, used in salads, vegetables, grains, and even simple bread. What first drew the attention of researchers was an interesting pattern. Populations that regularly consumed olive oil as part of their daily diet often showed lower rates of cardiovascular disease and better metabolic health compared to regions where diets relied more heavily on processed fats. This observation led scientists to begin studying what exactly makes olive oil different from many other oils. One of the key factors is the type of fat it contains. Olive oil is rich in monounsaturated fatty acids, particularly a compound called oleic acid. Unlike certain processed fats that can promote inflammation, monounsaturated fats tend to support healthier cholesterol balance and reduce inflammatory stress in the body. Oleic acid also appears to influence insulin sensitivity. When cells respond more effectively to insulin signals, glucose can move from the bloodstream into cells more efficiently, helping to stabilize blood sugar levels. But the benefits of extra virgin olive oil go beyond its fatty acid profile. High-quality extra virgin olive oil contains a variety of plant compounds known as polyphenols. These compounds function as antioxidants, helping protect cells and blood vessels from oxidative stress. Oxidative stress is one of the factors that contributes to the damage of the endothelial lining inside arteries, which can eventually lead to reduced vascular flexibility and plaque formation. Polyphenols in olive oil may help reduce that damage by neutralizing free radicals and lowering inflammatory signals inside blood vessels. Another interesting aspect of olive oil is how it interacts with digestion. When olive oil is consumed alongside meals, particularly meals containing carbohydrates, it may help slow gastric emptying and digestion slightly. This can contribute to a more gradual rise in blood sugar after eating rather than a sharp spike. For these reasons, extra virgin olive oil has become one of the most studied dietary fats in metabolic and cardiovascular research. To understand why extra virgin olive oil has attracted so much attention in metabolic and cardiovascular research, it helps to look more closely at what is actually inside this oil. When scientists analyze olive oil at the biochemical level, they find a combination of fatty acids, antioxidants, and micronutrients that interact with several systems involved in glucose regulation and vascular health. Let's begin with its primary component, oleic acid. Oleic acid is a monounsaturated fatty acid that makes up the majority of the fat content in olive oil. Unlike certain saturated or highly processed fats that can promote inflammation, oleic acid tends to support healthier lipid balance and cellular function. One of the reasons this matters for blood sugar control is that the structure of cell membranes is influenced by the fats we consume. When cell membranes contain healthier fats like oleic acid, insulin receptors embedded in those membranes often function more efficiently, allowing cells to respond more effectively when insulin signals them to absorb glucose. Beyond its fatty acid profile, extra virgin olive oil contains an impressive array of polyphenols. These are plant-derived compounds that function as powerful antioxidants. Polyphenols help neutralize free radicals, unstable molecules that contribute to oxidative stress inside the body. Oxidative stress is closely linked with both insulin resistance and damage to the endothelial lining of blood vessels. By reducing this stress, polyphenols help create a healthier internal environment for both metabolic and cardiovascular function. Another important compound found in olive oil is hydroxytyrosol, one of the most potent antioxidants present in the oil. Hydroxytyrosol has been studied for its ability to protect blood vessel walls from oxidative damage and to reduce inflammatory signaling that can contribute to arterial stiffness. Healthier arteries are able to expand and contract more efficiently, which supports stable circulation and reduces strain on the heart. Olive oil also provides vitamin E, a fat-soluble antioxidant that protects cell membranes from oxidative damage. Vitamin E plays a protective role throughout the body, including in nerve tissue, blood vessels, and the immune system. In addition to these components, olive oil contains small amounts of phytosterols, plant compounds that help regulate cholesterol absorption in the digestive system. By influencing how cholesterol is processed, phytosterols may contribute to healthier lipid profiles over time. When these components work together, oleic acid supporting cell membrane function, polyphenols reducing oxidative stress, hydroxytyrosol protecting arteries, and vitamin E stabilizing cell structures, olive oil becomes much more than a simple cooking fat. It becomes a complex nutritional compound system capable of supporting several biological processes involved in blood sugar balance and cardiovascular health. Now that we've looked at what extra virgin olive oil contains, the next important question is how these compounds actually influence the body, particularly when it comes to blood sugar control and the health of your arteries. Researchers generally focus on three major mechanisms when studying olive oil in relation to metabolic health: insulin sensitivity, glucose absorption, and vascular protection. Let's begin with insulin sensitivity. As we discussed earlier, insulin works by signaling cells to absorb glucose from the bloodstream. When cells respond properly to this signal, blood sugar rises slightly after a meal and then gradually returns to a normal range as glucose is used for energy. However, when insulin resistance develops, cells become less responsive to these signals. Glucose remains circulating in the bloodstream longer than it should, and the pancreas is forced to release more insulin to compensate. The healthy fats found in olive oil, particularly oleic acid, appear to help maintain healthier cell membrane structure. Cell membranes play an important role in how insulin receptors function. When these membranes remain flexible and healthy, insulin receptors are better able to respond to insulin signals, allowing glucose to enter cells more efficiently. The second mechanism involves digestion and glucose absorption. When olive oil is consumed with meals, especially meals containing carbohydrates, it can slow the rate at which food leaves the stomach. This slightly slower digestion allows glucose to enter the bloodstream more gradually rather than all at once. As a result, the spike in blood sugar after a meal tends to be smaller and more controlled. This effect helps reduce the sharp glucose fluctuations that place stress on the pancreas and contribute to long-term metabolic strain. The third mechanism relates to arterial health. Chronically elevated blood sugar can damage the delicate lining of blood vessels known as the endothelium. When this lining becomes inflamed or damaged, arteries lose their flexibility and become more prone to plaque buildup. The antioxidant compounds found in extra virgin olive oil, including polyphenols and hydroxytyrosol, help protect these endothelial cells from oxidative stress and inflammation. By supporting healthier blood vessel function, these compounds contribute to improved circulation and reduced cardiovascular strain. When these effects work together, improved insulin response, slower glucose absorption, and protection of arterial walls, olive oil becomes more than just a cooking ingredient. It becomes a nutritional tool that may help support both metabolic balance and cardiovascular health when used consistently as part of a balanced diet. Understanding how extra virgin olive oil works inside the body is helpful, but the next important question is practical. How can you actually incorporate olive oil into your daily routine in a way that supports metabolic health without making your diet complicated? The good news is that olive oil is one of the easiest healthy fats to include in everyday meals. Because it has been used for centuries in traditional diets, there are many simple ways to make it part of your routine. One of the most common approaches is using olive oil as a dressing for vegetables and salads. Instead of using processed sauces or heavy cream-based dressings, a small drizzle of extra virgin olive oil over fresh vegetables provides healthy fats along with natural antioxidants. When olive oil is combined with fiber-rich foods like leafy greens, tomatoes, cucumbers, or beans, the combination helps slow digestion and supports a steadier rise in blood sugar after meals. Another simple method is using olive oil with cooked vegetables. Lightly sautéing vegetables such as spinach, zucchini, broccoli, or bell peppers in a small amount of olive oil can improve the absorption of fat-soluble nutrients while adding beneficial monounsaturated fats to the meal. These nutrients and fats work together to support metabolic balance and cardiovascular health. Olive oil can also be used with whole grains or legumes. For example, adding a small amount of olive oil to dishes like lentils, quinoa, or brown rice not only improves flavor, but may help moderate how quickly carbohydrates from those foods are absorbed into the bloodstream. In terms of daily intake, most nutritional discussions suggest that 1 to 2 tablespoons of extra virgin olive oil per day can easily fit within a balanced diet. This amount provides beneficial fatty acids and antioxidants without adding excessive calories. Quality is also important. Extra virgin olive oil is considered the least processed form and retains the highest concentration of polyphenols and antioxidants. Choosing a high-quality extra virgin olive oil ensures that the beneficial compounds remain intact. When used consistently in moderate amounts alongside balanced meals, olive oil can become a simple and practical way to support healthier blood sugar patterns while also protecting the health of your arteries and cardiovascular system. Now that we've explored the first oil, let's move to the second one. This oil has been used for centuries in traditional health practices and has recently gained significant attention from modern researchers studying metabolic health. The oil I'm referring to is black seed oil. Black seed oil is extracted from the seeds of a plant known as Nigella sativa. In many traditional cultures across the Middle East, Asia, and parts of Africa, these seeds have been used for generations in cooking and herbal preparations. Historically, they were valued for their ability to support digestion, immunity, and overall vitality. What has captured the attention of modern scientists is the rich collection of bioactive compounds found within black seed oil, particularly a compound known as thymoquinone. Thymoquinone is considered the primary active component in black seed oil. Researchers have been studying it because of its strong antioxidant and anti-inflammatory properties. These characteristics are especially relevant when discussing metabolic conditions like insulin resistance and cardiovascular disease. Chronic inflammation plays a major role in the development of metabolic dysfunction. When inflammatory signals remain elevated inside the body, insulin receptors can become less responsive. This means cells struggle to absorb glucose from the bloodstream, causing blood sugar levels to remain higher for longer periods of time. Thymoquinone appears to help regulate certain inflammatory pathways, which may support healthier insulin signaling. When inflammation decreases, insulin receptors can function more efficiently, allowing cells to absorb glucose more effectively. Black seed oil may also influence how the liver manages glucose production. During the night, the liver naturally releases stored glucose into the bloodstream to maintain energy levels. In some individuals with insulin resistance, this process becomes exaggerated, leading to higher fasting blood sugar levels in the morning. Some studies suggest that compounds in black seed oil may help regulate this process, contributing to more balanced glucose levels over time. In addition to these metabolic effects, black seed oil contains antioxidants that help protect blood vessels from oxidative stress. This protection is important because damage to the lining of arteries often occurs alongside long-term blood sugar elevation. When blood vessels remain healthy and flexible, circulation improves and the cardiovascular system experiences less strain. To better understand why black seed oil has attracted increasing attention in metabolic health research, it helps to take a closer look at what is actually inside this oil. When scientists analyze black seed oil at the biochemical level, they find a complex mixture of fatty acids, antioxidants, and plant compounds that interact with several metabolic systems in the body. The most well-known compound in black seed oil is thymoquinone. This compound is considered the primary bioactive component, responsible for many of the oil's biological effects. Thymoquinone functions as a powerful antioxidant, helping neutralize free radicals that circulate in the bloodstream and damage cells. When oxidative stress accumulates in the body, it interferes with insulin signaling and contributes to inflammation in blood vessels. By reducing this oxidative stress, thymoquinone helps create a healthier environment for metabolic regulation. Thymoquinone has also been studied for its anti-inflammatory effects. Chronic inflammation is closely connected with insulin resistance. When tissues remain in a persistent inflammatory state, insulin receptors become less responsive to insulin signals. As a result, glucose remains circulating in the bloodstream rather than being absorbed by cells for energy. By helping regulate inflammatory pathways, thymoquinone may support improved insulin sensitivity over time. In addition to thymoquinone, black seed oil contains a variety of other beneficial compounds, including nigellone, thymol, and several polyphenols. These compounds contribute additional antioxidant protection and may help support enzyme systems involved in glucose metabolism. Some research suggests these plant compounds influence how the pancreas releases insulin and how muscle tissue absorbs glucose from the bloodstream. Black seed oil also contains healthy fatty acids, such as linoleic acid and oleic acid. These fats play an important role in maintaining the structure and flexibility of cell membranes. Healthy cell membranes allow insulin receptors to function more efficiently, improving communication between insulin and the cells that need to absorb glucose. Another nutritional element present in black seed oil is small amounts of minerals, such as zinc and iron. Zinc in particular is involved in many enzymatic reactions related to glucose metabolism and immune function. When these components work together, thymoquinone reducing oxidative stress, polyphenols supporting metabolic enzymes, and healthy fats maintaining cell membrane function. Black seed oil becomes a complex nutritional compound system that may support both metabolic balance and cardiovascular protection. Understanding the compounds inside black seed oil is important, but the next practical question is how people can actually incorporate it into their daily routine in a safe and consistent way. Because black seed oil is quite concentrated, only a small amount is usually needed. Traditionally,